Hi everyone, so I'm going to attempt to show and tell you about Orkambi and where we are 3 months along, and also a little bit of background on what it's doing, how it works, what's going on in the cells, and the CFTR protein. Yeah, I'm going to try and explain it as best as possible, so please do bear with me. There are some dodgy drawings, but I hope it's understandable and it's the way that I kind of understand it. So I hope that it's a bit simpler terms for you to also understand it as well. So this is a diagram of a cell inside of a cell of a person without cystic fibrosis. So the lungs of every person has tubes in their lungs called the airways, and people who don't have CF have a free flowing cell layer just here, letting the mucus flow freely. So this is what actually happens. So here is your CFTR proteins here in blue, and these pink dots are the chloride ions. So the chloride ions pass through the CFTR proteins and make it to the other side. It's quite easy with somebody without cystic fibrosis. This, being able to pass through very, very easily makes a good balance of salt and water in the body, making less sticky mucus and easier to move around the body, especially the lungs. And obviously when I'm gonna show you the difference, and you'll be able to see the difference in somebody who has CF and somebody who doesn't have CF. So this is a little diagram of somebody who does have cystic fibrosis and has the F508del mutation, which is actually the most common mutation of the CF world. There are thousands of different mutations, but this one is the most common, and the effects of this mutation affects how many CFTR proteins there are on that cellular layer, just there, and how they actually work. So as you can see here, that's the CFTR protein. There's not that many compared to the diagram that I've shown you before. These blue ones here are deformed CFTR proteins, so it's just deformed different. And because of the gene mutation, too fewer CFTR proteins are actually able to reach the cell surface. So the cell makes proteins that are not formed correctly, as I've just shown you there. The problem with the F508del is that the cell disposes of those proteins before it can actually reach. So it disposes of these deformed cells before it can even reach this layer. So literally gets rid of them. This is really difficult. So those that do reach the cell layer, like this one here, don't usually stay there as long as they are supposed to. So these chloride ions, these pink dots here, as you can see, there's one up the top there. So very few are able to get through because those CFTR proteins don't actually make it to the cell layer, and those that do don't stay there for very long. The chloride ions is what affects the salt and water levels in your body. So as you can see, it's very unbalanced. It's very, very unbalanced, and that is why we call our little CFers our salty babies, because the salt levels are higher and more concentrated, and that is because of this all kind of going on. It's unable to move and get through as easily. So now I've shown you the cell diagrams that I so badly drawn. I hope it helps you understand the start of it and like what's actually going on. Now I'm going to talk about how Orkambi actually works. So I have wrote down some notes, so do excuse me if I'm writing because it was a lot of information. So Orkambi, this little bad boy here, is a combination medication. So in here it has the Lumacaftor and the Ivacaftor, and they both do different things. So talking about that badly drawn diagram, the Lumacaftor part of the medicine helps more proteins get to that cellular layer. So those deformed ones, it helps for more cells like CFTR proteins like this get to the layer. It actually helps that and stay there for longer. The ivacaftor part helps the proteins to open up more so that these chloride ions can pass through a little bit easier. And that is basically it. That was, I know it's short and sweet, but that's basically it. And I mean, I'm saying basically, but there's a lot going on, you know, it's doing a lot. Now I'm going to talk about the side effects and like what we have seen when Amelia started it. Like I say, we're 3 months in now, which doesn't seem like a long time, but we notice a few side effects, but they've now completely gone. Especially within the first few days, there was increase in wind. I mean, she's a windy child anyway, but there was increase of wind massively. Like, it was hilarious. It was funny to us, but I'm like, oh my God, like, is this normal? Spoke to the respiratory nurse and she asked the consultant, yes, it was completely normal to increase in wind. Loose stool, diarrhea. She definitely had that within the first week, maybe longer, 10 days or so. Not quite 2 weeks, but definitely a good few days after. She had diarrhea and very loose stools. And for the first time since she started Creon when she was 2 weeks old, I saw mucus in her poop. And I was like, right. But it's basically, the way the consultant explained it to me was it's her body is clearing out the mucus, and you know, it's getting those cells moving and getting those cells open to make the mucus less thick. Absolutely blows my mind. It really does. Sorry, I'm just reading my note. Liver function. So one of the side effects is obviously liver function tests, and the blood tests will be regular. We have her first blood test next week, so I'll be able to tell you a little bit more if they can tell me numbers or if it's decreased the numbers. I haven't got a clue what the numbers were in the first place, so you know, but I will certainly ask the question. Because I want to know, I do want to know if there is a difference. We also are having another sweat test next month, so that will be 4 months after. Again, because of the ions, because of the chloride, it can affect the salt levels, and the only way to test that is a sweat test. So we will be going for a sweat test as well next month. So I'll be able to update you even more on that. Other side effects that I've noticed. So Amelia's only been unwell. October, she had a chest infection. But she just started taking Orkambi then. And it took 2 lots, so 4 weeks of antibiotics to rid it. And then just before Christmas and over Christmas, she had a chest infection again, but so did Alfie. So that took 1 lot of antibiotics, just because that, well, it went on for longer than 2 weeks. I don't know if you saw, but my posts about the tablets, they gave us tablets. They didn't have any liquid form antibiotics, and she wouldn't take the tablets. So yeah, it was longed out longer than it should be, but it seems to be when she's having those 2 weeks, she's getting better, even quicker. She right at the beginning of taking Orkambi, she was very breathless. very breathless. But again, that subsided after a couple of weeks. She had a bit of a sniffle. So it was, and then she got the chest infection. So it was kind of like, is this her body just like clearing everything out, you know? So, fatigue as well, cataracts. Orkambi can cause cataracts, not in many cases, but they obviously have to give you those statistics and chances. So yeah, so she had an eye test before she started Orkambi, and it was literally just a shining the light in her eye. She was too young to have a full-blown eye test, so they was literally just checking the lens with the light, both sides. It was literally 2 minutes. If she would have sat still, it would have been even quicker. So that was all good, no sign of cataracts, but then we will repeat that again next month, to just make sure everything's okay, really. And then I think the nurse said we don't have to repeat that eye test until she's had a year on Orkambi. So that'll be again in October. So next month, again in October. Amazing. And hopefully it's all good. So yeah, so basically the testing afterwards, like I say, I don't really know too much. I just know that she's got the blood test, she's got another eye test, and sweat test as well to have a little look. Overall, she's just been generally a lot more well. And like I say, when she has caught something, it's taken less time for it to go. So yeah, it was hit and miss over just before Christmas, when way before Christmas, I'm losing tracks. Over Christmas, before Christmas, oh my gosh, before Christmas, November time, they was kind of like, if this doesn't go, she will need to come in for IVs. But the second time she absolutely bossed it and got rid of it, so that avoided that. I mean, she's not been in for IVs, it'll be a year in February, and she's only been in once so far. And I know sort of mums on here talk about, oh, you know, my child's 7 and they had their first IV stay, and then there's children that have IV stays very regularly, and it doesn't make you as a parent any uncleanliness or hygiene or anything like that. It is unfortunately just one of those things. So people who do judge you, it is literally their problem. And especially if they don't have a CF child, they don't understand, so ignore them. But yeah, so I hope that helps in understanding what actually Orkambi does, the side effects that we had. She has got no side effects now at all, they've all gone. And we take Orkambi with a morning milk and an evening milk as well, because we tried different ways. We tried yogurts, I tried porridge, I tried all these other ways. And because before she had yogurt, but I think she knew I was putting something in the yogurt, and then that was it. Then she was like, no, I'm not having that. What is that? Same when we gave her the tablets. Speaking of the tablets, she actually had a week off of taking Orkambi, and it absolutely scared the living daylights out of me, because she was just getting amazing, and then she was not very well and needed a little bit of help with antibiotics, and they only had tablets in stock. It was when the antibiotic shortage, well, it's still around now, the antibiotic shortage was taking hold over Christmas, and she was like, no, I'm not having my Orkambi, how dare you? Because we kept trying to hide the tablet in things, like melt it down into a syringe. It was just horrendous. So she actually had a week where she wasn't taking her Orkambi, and not that I saw too much of a difference, but then I saw the same side effects again when she was taking it regularly, when we was back on the liquid antibiotics, and she was back on taking all of her medication again as normal. So yeah, I would say that. So she was very windy again, she was very loose stools again. I mean, that comes with antibiotics as well, but yeah, it's different. Like I say, you can see the mucus in the poop, so there's a difference. But yeah, I'm going to stop babbling now. And I hope you're all well, and I hope you found that helpful. So yeah, all take care, and if your little one's starting this bad boy, the best of luck, and watch out for those symptoms and side effects, and please consult your team with anything you're worried about. I'm sure they just want to reassure you, check little one over if they need to, and they are there for you and for your little ones. I completely forgot to say the main thing that we have had with Amelia, and I say this not as in a bragging way or anything at all, because I know people with CF are completely different. They can have the same gene mutation as Amelia and be affected so differently. But her creon amounts, I mean, I spoke a lot about the lungs, and when I was talking to the dietitian and I was talking to the consultant, I was saying, I'm not having to give her enough, more, the amount of creon I was before. Like, is this normal? And he said it's not common, but it's not uncommon for that to happen. They are still trialing, testing. You know, Amelia's a little bit of a guinea pig still, for our team especially, because it's quite a small amount of CF children. Then we see the main hospital twice a year. But the team that we go to are amazing. They are amazing. But yes, I'm like, I'm not having to give her as much creon. She was getting quite constipated. Once sort of those first side effects started to go down and go away. And it was about 4, 5, 6 weeks after of taking it morning and night at the same times, as close to 12 hours apart as possible. I mean, she gets up at 7 and we give her it around 6:30, so it's only half an hour out, but it's not too bad. It takes her sort of half an hour to drink it all anyway. So as close to 12 hours as you can get. Yeah, and I was like, you know, we're not giving her half as much creon. She was very constipated, pebbly stool, and the dietitian said, look, lower it down. But I'd already lowered it down without, you shouldn't. You should always consult. But I did say to the dietitian, don't shout at me, but I've lowered her creon down already. So, yeah, she was, before Orkambi, she was between 20 and 25 scoops a day. Then it lowered down to 10. Then it lowered down even further to the point where we was finding ourselves not even giving her any creon. And as amazing as that is, I hate to, you know, make people feel horrible, but that was the bottom line of it. And she was having no creon whatsoever. And that spout where she wasn't taking her Orkambi, we was having to give her creon again. So it's quite clear that the Orkambi was doing its job. And the consultant did say to me, look, we've got research about the lung side of it, but the digestion side of it, we're still learning. And he did say that I think we're the second family to start this recently at their hospital, and they've had the same result of not having to give her any creon. And because now she's had a good 4 weeks solid on it, again, I'm having to lower her creon down again. Sorry, excuse me. So that's another major side effect. I'm so sorry I forgot to even say that, but you know, it's a major one. So yeah, it's pretty amazing. Pretty amazing. And like I say, Amelia's age is kind of still the trial age. So I'm really intrigued to see how Calf Trio does the job.